Good afternoon, and welcome to this afternoon's Forum for Healthcare Workers. I am Dr. Ajit Raj Singhvi, President of the Riverside County Medical Association. New regulations for healthcare workers are now requiring the COVID-19 vaccine. We know many of you still have questions before receiving their vaccination. This afternoon, we invite you to ask your questions. On the bottom of your screen is a Q&A button, and you can submit an anonymous question at any time. We have reserved about 20 minutes at the end to ask those questions to our panel of experts. We are going to start off by hearing from Alicia Wagnon, ESQ, who is the Deputy General Counsel for the Center for Legal Affairs at California Medical Association. She will address the new healthcare vaccine regulations. Following her, you'll hear from board-certified infectious disease and internal medicine expert, Dr. John Persichino, who will share about the vaccine, efficacy, and why it is recommended. Next, Dr. Calvin Patel, a hospitalist, will share his experience in the trenches treating COVID-19 patients every day. And lastly, we have family medicine physician, Dr. Geoffery Leung with the Riverside County Department of Public Health, who will give an update on COVID-19 in Riverside County. Ms. Wagnon, I'll ask you to begin, please.
Thank you very much, and good afternoon, everyone. I am Alicia Wagnon, Deputy General Counsel and Director of Corporate Affairs at the California Medical Association. And I'm here to share with you about the recent health orders that have been issued by the State Department of Public Health. Generally, there are three relevant orders that apply to workers in healthcare settings that relate to vaccination. Those orders will essentially, which order applies determines what setting the worker works in. The first group of individuals will be workers in healthcare settings, including general acute care hospitals, skilled nursing and subacute facilities, intermediate care facilities, acute psychiatric hospitals, adult day health centers, PACE centers, ambulatory surgery centers, chemical dependency recovery hospitals, clinics and doctors' offices, including behavioral health or surgical, congregate living health facilities, dialysis centers, hospice, pediatric day health and respite care facilities, and residential substance use treatment and mental health facilities. Individuals who are workers in these healthcare settings are required to be fully vaccinated by September 30th. There is no test out option for the workers in these particular healthcare settings. This is in contrast to a July 26th health order that was issued that also covered those facilities, but was later overridden by the August 5th order. So workers who are covered by the July 26th order that have a test out option to the vaccination requirement include those in adult and senior care facilities, homeless shelters, state and local correctional facilities and detention centers, adult day programs licensed by California Department of Social Services, and dental offices. There was a third order more recently on August 19th that applies to all workers who work in correctional facilities or detention centers. For workers in this grouping of healthcare settings, those workers must be fully vaccinated, which means having their one shot or both doses of a two-shot vaccine by September 30th, 2021, or they must prove that they have tested negative for COVID once or twice, depending on the setting that they work in. There was a fourth order that was issued that applies to healthcare facilities for visitors, and we won't get into that, but visitors in your general acute care, skilled nursing, and intermediate care facilities are all subjected to a vaccination or proof of negative test results requirement. In the employment setting, Most of the orders are going to apply to those who are both directly employed or are contracted to work in these healthcare settings. And under the law, exemptions from these orders would typically fall into three different categories. One, for a qualified medical reason. Second, for sincerely held religious belief. And three, as a reasonable accommodation for a disability under the Americans with Disabilities Act. All of those scenarios are very fact specific and would have to be looked at on an individual basis. But generally speaking, all workers, and you don't have to be just a licensed healthcare provider, it's all workers in these health facilities that I've delineated that are subjected to the orders that have been issued by the state public health department. That's a general overview, and I will hand it off to our next speaker.
I am Dr. John Persichino, and I just have a couple minutes. I just wanted to introduce myself and just give you a couple points of information that I think is significant. I'm an infectious disease doctor here at Riverside Medical Clinic. I'm also on medical staff at Riverside Community Hospital, Parkview Community Hospital, and Corona Regional Medical Center. I'm clinical professor at the UCR School of Medicine. In terms of the work I've done with the COVID over the past 18 months, I'm chair of the COVID task force here at Riverside Medical Clinic, as well as a member of the task force at Riverside Community Hospital. I do want to let you know I'm not the only ID expert locally in the county. I do want to recommend you to reach out to my local ID colleagues at your facilities. You can either talk to Dr. Malela, Rahim, or Laketti in Riverside, Dr. Nayak in Corona, Dr. Lay or Harfouche in the Temecula-Murrieta area, or Dr. Sujita Wang or Dr. Wu in the Moreno Valley or Riverside County area. I just wanted to mention those people as well. I wanted to give you my observations, my experience in the review of the medical literature during this hour. Did want to let you know I logged in over about 11,000 hospital days and taken care of around 1,300 COVID patients in the hospital setting. In terms of the vaccine data, you can go to the CDC or you can go to Johns Hopkins Resource Center. In terms of the vaccines, 170 million Americans have been fully vaccinated, which represents around 51% of the total population. In terms of the amount of dosages that have been given, 363 million doses have been given throughout the United States. This was data from yesterday. 47 million doses have been given in California, which we are the leading state in terms of the number of vaccines per our state. In terms of the doses of Pfizer, 205 million doses, Moderna, 143 million, and J&J, 14 million. This past Monday, as many of you know, the FDA approved the Pfizer vaccine in ages 16 and older. There's also an EUA, emergency authorization, for ages 12 to 15. And also next month, Pfizer is expected to submit an EUA for ages 5 to 11. Moderna this week also submitted FDA approval for ages 18 and older. So I just wanted to just briefly give you some articles that have been published in the MMWR. You can go to the CDC website and just to briefly educate you about the benefits of the vaccination. In terms of Los Angeles County, it was published just recently, this past week or two. They looked at patients who were hospitalized, either vaccinated or unvaccinated. They found that you had a 5 times risk of infection and 29 times the risk of hospitalization among unvaccinated persons versus those who are fully vaccinated, especially in the Delta variant predominance. And I learned last night, and Dr. Leung could also mention this too, in Riverside County, that it was 5 times the risk of infection in LA County, but here it's 37 times the risk of infection if you're unvaccinated. And what's also interesting too, what I learned last night is that if you're unvaccinated, you have 120 times the risk of dying here in Riverside County if you're unvaccinated compared to fully vaccinated. Also, I get this question a lot. What about those who are previously infected? Should I get a vaccine, or will my immunity last? Well, there was another article that came out at MMWR this month that being unvaccinated was associated with over 2 times the risk of being reinfected compared to those who are fully vaccinated. Another thing is amongst healthcare workers, want to let you know the vaccine effectiveness has decreased because of the Delta variant predominance. It went from 91% to 66%. So I do want to let you know it has gone down because of the Delta variant predominance. Lastly, there was an article that just came out in Israel. Israel's they're about 1 to 2 months ahead of us in the booster. The data came out that if you give a booster to people in Israel, that the vaccine efficacy went up to 86%. So potentially from 66% to 86%. This is all I have to say. I left my time to questions at the end.
Hello, everybody. My name is Dr. Calvin Patel. I'm a hospitalist with Providence Healthcare Partners. And for those of you who don't know me, my team and I have been providing care for patients in both Riverside Community Hospital and Parkview Community Hospital and local skilled nursing facilities. I sit on various committees, including those committees set up to deal with COVID, and I'm the chief of staff elect at Parkview Community Hospital. I could sit here and rattle off my credentials, and tell you my story, but I don't think that matters right now. What matters is the story of those who've gone through this pandemic and have had to deal with the complications of COVID and what we can do to try avoiding that. For the last 18 months, we're all faced with COVID, and my colleagues and I have been tirelessly taking care of these patients. There was a lot of uncertainty in the beginning stages of the pandemic, and we've learned a lot since then, to say the least. We've learned about the virus, such as transmission, treatment options, vaccinations, and we continue to learn a lot about the virus and its various strains, including the most predominant strain in our community, the Delta strain. And we understand that there's a lot of questions in the community, and for this reason, we appreciate everyone coming to this town hall meeting to ask these questions and take time out of their busy schedules to do everything in their power to responsibly deal with this pandemic. And that way we can avoid contracting and spreading COVID. And one of the best ways to do that is obviously wear the PPEs and good hand hygiene, et cetera, but getting the vaccine. My colleagues and I see COVID-19 complications on a daily basis. And since the beginning of this pandemic, we've unfortunately had the responsibility to call those family members, friends, loved ones, when patients have suffered from COVID-19 and their complications, including death. I was one of the people you didn't want to get that phone call from during this time frame. As far as stories and what it's like in the trenches, I'm sure some of you in some capacity or another have had family members, friends, loved ones, or colleagues who can testify to the heartbreak and trauma, tragedy we've been witnessing for the past several months since the beginning of this pandemic. We've not only lost some of our own colleagues to this disease, but friends, family, loved ones. The list is long. The nurses, respiratory therapists, doctors, technicians, therapists, CNAs, residents, all the employees of the hospital have been working tirelessly to make sure that we can treat patients in the best possible capacity with the limited resources that we have. And we've seen respected, loved colleagues retire, get sick, and other colleagues step away from the field due to the inordinate amount of emotional and physical trauma that has happened since the beginning of the pandemic. So to all of you who've been part of the healthcare force and doing your part, thank you for your hard work and dedication. Commitment to treat our friends, families, community members, it's a priority. As far as why we've gathered, it's to answer these questions that hopefully we'll get to pretty quickly, and encourage those people who are not vaccinated to get vaccinated. The best way to do this is just go out there and educate yourself like you're doing now. And I wish I could show you what we've seen in the hospital, and I'm sure that would be enough to get people vaccinated. Currently, our patients in the ICUs, what we're seeing, are younger on average than they were when COVID first started. And the Delta variant is more virulent and definitely harder to manage when it comes to some of the complications we're seeing. Just in the last week, I've had to max out on pressor support on multiple different patients, which we really didn't have to do when COVID first started. It was more of a respiratory support issue, but we're seeing more complications. So in this last week, I've managed multiple patients in the ICU. Most of them are young, and the majority of them have been unvaccinated, who all regret not getting their vaccinations. And I've seen them make phone calls and plead with their family and friends to actually go out and get vaccinated. You know, I believe empowering yourself with the knowledge of all the different studies out there and helping make your decision more comfortable. I believe once you empower yourself with the knowledge of these studies, I'm sure vaccination will be a lot easier to get, especially after listening to the statistics by Dr. Persichino and the recent studies published in LA County regarding those who were vaccinated versus those who were unvaccinated. Anything we can do to decrease the suffering and trauma that we've already seen. We're here to answer questions and hopefully encourage you to get vaccinated. I'll turn it over to the next speaker.
So, we just wanted to share a few highlights from the public health perspective. And the first is when you take a step back and you look across the country, the places where we are having the outbreaks and sort of the hospitals that are beyond capacity, they're really all in communities with lower vaccination rates. And in the communities with higher vaccination rates, we're actually seeing that either hospital volume is not touched or that it's even dropping. And so we know, that vaccination piece has a tremendous impact, not only kind of on how hospitals function, but, the number of people who get infected, the number of people who have serious complications, and the number of people who die. Dr. Persichino kind of touched on that, and it really is very dramatic. When you look at all the people who've had COVID in Riverside County, almost all of them, more than 90% of them are people who have not been vaccinated. And really it's the same thing in the hospital. And when you look at our deaths, although we're reporting, 4,000, almost 5,000 deaths, only 23 of them in our county have happened in people who've been fully vaccinated. So it makes a huge difference. We do want to share that the other trend that we see in vaccination sort of patterns is that, areas with higher socioeconomics, with higher degrees of education, communities that tend to have sort of improved environments, they tend to get vaccinated at the highest rates. So places like in Northern California, like Marin County, San Francisco County, they have very high vaccination rates. And unfortunately, it's the neighborhoods that we are most concerned about that tend to have, lower socioeconomics, that tend to have more minority populations, that tend to have lower education status. And those are the areas that tend to have the lowest vaccination rates. And often it's 20, 30, 40 percentage points lower than those areas in the highest that are in the highest socioeconomic groups. So for that reason, COVID is really impacting us disproportionately, and it's hurting most our underserved communities. We hear a lot of concerns about sort of the newness of the vaccine, or can you trust vaccines? And we do want to remind people that vaccines have been around for over 100 years, and we day in and day out we take our kids to get their vaccines. It's very routine. There are over a dozen vaccines that we give to our kids, types of vaccines that we give to our kids before they're 18 years of age. And, we don't have typically this type of controversy. So we know, there's a lot more emotion tied to COVID and the vaccine and masking. But kind of when we take a step back and just think of this as another routine vaccine, we've got a long history of using vaccines very safely and really helping to prevent, bad outcomes and death. And then, what we're seeing in children, there's sort of a misconception that children really aren't affected. In Riverside County, we've had over 17,000 kids who've had COVID. We've had a lot of kids who've been in the hospital, and probably the greatest risk with kids that we see is, they are very likely to pass the infection on to other members of the family or loved ones that you don't even realize may have, underlying medical conditions or maybe older. So that's a very big risk. And with vaccination, that dramatically drops the risk. Another piece that we commonly hear is, beliefs related to faith or religion. And we do just kind of want to make sure people know that, many religious leaders have come out and really have been advocating for the vaccine. The Pope recently made a statement about how the vaccine is essentially a gift or a miracle and is an act of love because, when you get vaccinated, you're not only protecting yourself, but you're protecting the people around you. And that's sort of the last message that we just want to leave with everyone, that, as healthcare workers, all of you, are role models and mentors within your micro communities, and people really look to you to see what you're doing. And if you decide not to get vaccinated, probably more people around you will decide to not get vaccinated. If you decide to get vaccinated, that can also have a ripple effect and can not only sort of increase the likelihood that your family will get vaccinated, but even your family's friends will get vaccinated. So thank you for taking the time, and we hope we'll be able to get through all the questions today.
Thank you so much to each of the panelists. I am going to jump right into the questions. If everybody could, if the panelists could turn on your video, that's great. So Alicia, the first few questions, I'm going to put them all into one question, and it's regarding the religious beliefs exemption. And there appears to be confusion as to what that form or letter should look like. It appears that there's some boilerplate letters that are out there. Are those acceptable, as well as what does the employer need to do to verify the religious exemption?
So there is no set standard that I'm aware of for what the request for a religious exemption must say. Clearly, each person's religious beliefs are going to be different based upon what those beliefs are, what their religious affiliations are. So the religious exemption request would set forth the individual's particular beliefs that they are basing their request for an exemption on. And there's not one particular structure or set standard. I have not seen a lot of form letters out there. So I can't really speak to that as a general rule. And employers need to do a good faith evaluation of the request for religious exemption. And my understanding is the primary standard is that it be a sincerely held religious belief, but there's not a particular standard in the law as to how the employer is required to evaluate their request for exemption.
I think I believe you said that all medical practices were included in the vaccination. So that would include oncology, orthopedics, no matter where they work within the office, whether it's administration or through clinical care. Can you please just verify that?
Sure. The orders are very specific. They say workers in the defined healthcare settings. So if you are a worker, whether that be a janitor, an administrative person, or a frontline medical provider, you are covered by these orders. And the only difference is which group of healthcare facilities you fall under in terms of whether you must be fully vaccinated or have the option to provide negative test results in lieu of vaccination.
Is it suggested we get a different vaccine than we were originally inoculated with? And how soon can we obtain this?
So the CDC says that, ideally, if you get the Pfizer vaccine, you should get the Pfizer booster. The data on the boosters is with Pfizer right now. I don't know of any booster data for Moderna. Just to let you know that I get this question all the time. So let's say you get your 2 doses of Pfizer and you want a booster, you can get the booster 28 days after the second dose. Do want to let you know. So if there is a situation that you're a patient and you had the 2 Pfizer vaccines and you say I want to get the booster with the Moderna, I do want to let you know the Moderna, in terms of its antigen load, it's about 3 times the amount as Pfizer. Pfizer's about 30 mics, Moderna's about 100. So there's this theory out that maybe you might get more side effects. So the CDC still is kind of on the fence. They're going to look at the data on the safety and the efficacy and make some recommendations. And boosters should be coming out, mid-September. I believe it was September the 20th.
Next question. Is there any specific data on Pfizer versus Moderna efficacy against the Delta strain?
So there's a great study that came out through Mayo Clinic. I sent it to my colleagues here at RMC. It looked at 50,000 patients throughout the Mayo Clinic consortium throughout the United States, and they found out that after 6 months of being fully vaccinated, the Pfizer did not really hold up. It was around 42% versus Moderna of around 70%. So there's talk, and I get this question all the time because of the study as well. Should I get the Moderna as my booster if I had 2 Pfizer vaccine? And the jury's still out on this. So I would recommend, let's wait for what the CDC says and go from there. Maybe Dr. Leung could add to that as well. But that's a hot topic and question.
I don't have anything to add to Dr. Persichino's wisdom right now.
Okay. All right, next question. Any stats on the effect on fertility with the vaccine? Dr. Leung?
So, what we do know is that from all the data, we don't see any impact on fertility. So we know this has come up a lot in social media. It continues to be a top concern, for women, for parents, for, people who are potentially want to become pregnant. And it's sort of very hard to combat that social media message. But when we look at all the science, when we look at all the evidence, if you talk to, our OBGYN specialists, they will all consistently tell you that, there are no concerns about impacting fertility.
Next question. Just wondering if there is any data in regards to the current people who are getting COVID right now. Is this the first time that they have had it, or did they have it before as well?
So maybe I can start with that. When we look at our county data, it is a small number of people who look like they're getting a second infection after a first COVID infection. But we also know that we're not collecting all the data and not everybody's getting tested. So, oftentimes people who've had a first COVID infection, they think they're completely immune. So afterwards, when they have cough or cold symptoms or fever, they're assuming it's something else. So we know we're not capturing all of it. However, we do know from other studies, including ones that Dr. Persichino has referred to, that the likelihood of getting an infection following a natural infection versus, the likelihood of getting an infection after vaccination is dramatically less than than after a previous infection. So meaning a vaccine is much better at giving you protection or immunity than a natural infection.
Can we provide boosters now to healthcare workers? Dr. Leung.
So the FDA and the CDC have been fairly clear on this one, and we are not supposed to be providing additional vaccine doses or boosters to the general public or healthcare workers if that's their only qualification. Right now, the additional vaccine doses only for those with moderate to severe, who are moderately or severely immunocompromised, such as people who might be getting cancer treatment or people who've had an organ transplant. The other thing that makes this vaccine unique is, doctors' offices receive this vaccine for free. So when they receive the vaccine, they actually sign an agreement that says, I'm going to follow the recommendations from the CDC, and I will not use this in an off-label manner. So, we're not supposed to be giving this off-label at this time, even though we know that there are some priority groups that we would like to think about as the booster hopefully becomes available soon.
What are we seeing with regards to vaccine reactions? Are there statistics in regards to reactions?
So, I think Dr. Patel or Dr. Persichino could answer this just as well, if not better, but we tend to see a couple types of reactions. The first is the mild reactions that we don't worry about, and they tend to happen in the first 24 to 48 hours after getting the vaccine. That might be anything from feeling tired to having headache or a little bit of fever or soreness in your muscles. The reactions that we tend to worry about more are either the very strong allergic reactions, or some of the very uncommon but significant reactions that you may have heard about, such as the very rare blood clots that we might see after the Johnson & Johnson in specific groups of people. But when you look at kind of all of the data in totality, it does look like, the COVID vaccines are very, very safe and very effective, especially when you compare them with other vaccines that we've been using.
Alicia, back to you. For the medical exemption, what needs to be included in the letter or the exemption? A medical history, a physician's note with medical exemptions, what needs to be included?
Sure. So the first two primary orders that the state issued related to workers in the healthcare setting did not specify what had to be in a request for medical exemption. The August 19th order from CDPH does talk about a qualified medical reasons exemption, and it has to be signed by a licensed healthcare practitioner and is not to describe the underlying medical condition. And it has to indicate the probable duration of the worker's inability to receive the vaccine, or if the duration is unknown or permanent, so indicate. But that's really all it says. It doesn't, there's no other standard form that the state has issued or delineated.
Several questions about trusting the vaccine because it was made so quickly, and how can you explain why people should be concerned or not concerned with the short amount of time in our medical world that the vaccine came to market?
So I get this question a lot, especially with the Pfizer and the Moderna vaccines as the RNA vaccines. This is actually not new technology. The RNA vaccines, especially the development of it, has been going on for years. I don't know if many people know this, but the Zika virus is a RNA vaccine. It was approved a couple years ago. We never really went out and got it all because Zika kind of went away. But I do want to let you know it's not new technology. I do answer this question for my patients. Yes, I mean, they're new vaccines. We don't know what the long-term consequences are. But Dr. Patel and I can tell you, we know what the consequences of COVID infection are, especially when they're in the hospital. You know, we see, you know, blood clots, we see neurological abnormalities, psychiatric abnormalities, strokes, heart attacks. So I really pinpoint, you know, what I observe and what I see as the complications of infection, rather than worrying about we don't know what the consequences of long-term, you know, vaccine users. That's my take on that. Maybe Dr. Leung could comment more on that.
You know, I agree with Dr. Persichino, and I think we just have to remember, you know, what the risk is when we're not vaccinated, and sometimes that's the piece we forget about. There is significant risk. You know, we do have a very contagious Delta variant right now. Our hospitals are struggling right now because we have so many sick COVID patients. And actually, we just heard this morning that, you know, although the state of California is doing well as a state, within California, Riverside County actually has the second most COVID hospitalizations, second only to Los Angeles County. And the only way that we can bring down, you know, the number of people being hospitalized in our county for COVID is really to sort of, you know, come together as a community and take those precautions and really nudge everyone who's eligible to get vaccinated to get vaccinated.
Thank you. Alicia, back to you. For the exemptions, then does the employee, the healthcare worker, need to be tested on a regular basis after October 1?
So the orders do not impact other orders that are in place. And if there's going to be an exemption, then the testing and PPE and other precaution requirements must still be followed.
And then September 30th is the deadline that we move from testing and or vaccination to vaccination with the exemptions, but testing. Is that correct?
So the September 30th deadline applies to the first two orders that are applied to the workers in the vast majority of healthcare settings. The difference is a certain classification of healthcare settings. Those workers will continue to have the option, if they do not vaccinate, then they can test out negative, provide proof of negative testing once or twice a week, depending on their setting. But for workers in the healthcare settings that are specified in the August 5th order, which was the first list that I went through, they do not have the test out option. And then there's the third classification of workers, which are in the correctional and detention facilities. that do also have a test out option or provide proof of vaccination, and their compliance date is October 14th.
Okay, here's a different question that I've not seen asked before. I want to get vaccinated, but I am someone who suffers from health anxiety, and just thinking about getting the vaccine, I get anxiety attacks. I see so many people that have gotten it with no effect at all, but then I hear so many stories of people with bad experiences. How can I get over this fear, and what is recommended for someone like me?
Anxiety is a common problem that we all have dealt with, and especially when dealing with unknowns. It's important to not let it control you and have those fears sort of decide what's in your best interest. There are a lot of therapists in the community that can help with cognitive behavioral therapy and also guide you through those anxieties and encourage you when you are having those moments, to teach you how to manage those levels of stress, so that you can go through with this vaccine.
I think we do have to recognize that, anxiety is very real, but the importance of talking with your healthcare provider or through whatever clinic you go to help you work through those issues is very important. Okay, here's kind of a multi-part question that's a little long, but it has, I think, good questions that are being asked. Thank you for your work during this pandemic. I appreciate the panel taking time out of their busy schedule. Essentially, a three-part question. In a few countries such as Australia, the goal is 0% COVID positive goal. Is this even attainable given its presumed zoonotic origin and respiratory transmission?
So, this is a great question. And I think, there are people, much smarter than me who've been wrestling, with this theoretical question. So you have many reservoirs right now of infection, especially in places with low vaccination rates, either across our country or in other parts of the world. So what is a realistic goal, especially in a global economy where people are traveling and constantly. We think that it is a reasonable goal to be able to bring our levels down to a point where people can function normally in society, where hospitals are not impacted, where healthcare workers are not feeling burned out and tired every day. And if we can just get our vaccination rates up a little bit more, and hopefully with the added expansion of eligibility into younger children, hopefully in the winter, we think that can decrease the transmission enough so that we can be talking about and thinking about different things. So, I don't know if Dr. Persichino or Dr. Patel has anything to add there.
I agree with Dr. Leung. In order to combat this infection and to prevent further spread and to get back to normal lives, I'm sure people have heard what is called herd immunity. We need at least 80 to 90% of the population to achieve herd immunity to bring down the virus. And especially the winter months, that's when we're going to be indoors. It's going to be colder, and that's where we get COVID. We get COVID indoors.
So what is the difference with those who have had COVID and still have antibodies versus those who didn't have COVID and got the vaccine? At what level of antibodies is considered good, a good high level or low, or do you know yet what the range should be?
I get this question all the time. So right now, there is no FDA approved test to measure your antibodies after vaccination. I just want to let you know that people are getting the antibodies that are out there to test for if you're infected, like 2 weeks sometimes, if the antigen is negative or the PCR is negative in your nose and you have a high clinical suspicion, then you can check an antibody. But right now, I don't know of any FDA approved tests to even check your antibodies. And what would the level of the antibody be? Just do want to let you know that after infection, your antibodies go down after 3 months. So that's why the current recommendation by the CDC is if you're infected, you should get a COVID vaccine within 3 months. That's what I have to say. I don't know of anything that's coming out in the market right now on COVID antibodies, especially after vaccination. Do you know any, Dr. Leung?
I'm seeing a shake of head, so thank you. Okay, Alicia, back to you. Are healthcare workers or employees who are 100% remote or in a separate office building, no patients or clinical treatment, considered workers as part of the state order?
I would have to say yes. There's no distinction in the orders between the location where you work that I'm aware of. So if you are a worker, because they say it applies whether you are in contact with patients or not, it applies to you, whether you're employed or you're on contract. So that's, I can't give legal advice, but that would be my general assumption, is that it would apply regardless of the physical work site location.
Thank you. Okay, one last question since our time is closing. Is the composition of the booster dose the same as the original vaccine?
So in terms of the Pfizer, it should be 30 mics. In terms of the dosages for children, there's talk about, less than 12 years of age. It could be 20 mics or 10 mics. We'll still figure out what the dosages are going to be for kids. In terms of the Moderna vaccine, it's 100 mics right now. We don't know what the booster dose would be. Like I stated before, the dosage of Moderna is at least 3 times as large as Pfizer. So the jury's out on that. I don't know if Dr. Leung wanted to, add into that, but I do know there's talk about, looking at different dosages, especially in kids, especially with the Pfizer. I don't know of any dosage adjustments, to my knowledge, currently for the Moderna or the J&J.
That is my understanding as well.
Okay, our time is at the end. Dr. Singhi, I'm going to turn it back to you.
I want to thank all of you for joining us, along with our panel of experts, Ms. Wagnon, Dr. Persichino, Dr. Patel, and Dr. Leung, for taking time to be with us. My sincere thanks to Dolores and her hardworking staff at RCMA, Richard and Teresa. Please visit myturn.ca.gov to schedule your vaccine appointment. Have a good weekend and stay safe.